Hey guys, Dr. Childs here. Today we're going to be talking about the prescription medication known as Naltrexone, and we're going to be talking about how Naltrexone can actually help with weight loss. So if you've never heard about Naltrexone, another name for it is LDN, which stands for low dose Naltrexone, which some of you may have heard about it and utilized in that way. And LDN is used oftentimes to treat autoimmune conditions like Hashimoto's thyroiditis. But it also has some unique properties which make it very effective at helping people lose weight. So we're going to talk about that today. If you don't know me, I'm Dr. Childs. I'm an internist. I specialize in treating thyroid problems, helping people balance their hormones, and also helping people with weight loss, which is the topic of this discussion. So let's get in here on this topic today, and we're going to pull out the whiteboard. So as I said, we're going to be talking about Naltrexone, and a lot of people refer to it as LDN or low dose Naltrexone. And that is simply because when we talk about it, when I talk about using Naltrexone, I'm really talking about using it in low dosage. Okay, and so most of the time, if you just get a prescription from your regular doctor for Naltrexone, you're going to get a 50 milligram dose, which is pretty high. We're talking about 1.5 to really 4.5, maybe a little bit higher for the weight loss weight loss therapies, and if it's used in that way. But this is much different than when you get it from your regular doctor. So if you're going to get it, you generally need to get it from a physician who orders it from a compounding pharmacy so they can get that lower dose. Now, Naltrexone is very interesting because it really isn't a weight loss medication. Now, some people do recognize the fact that it can be useful for medication. In fact, it's combined with certain medications, and these are FDA approved for weight loss, and Naltrexone is part of that. So conventional physicians do recognize, at least some of them if they're savvy, recognize that it can be used for weight loss. Okay, so we're going to talk about why exactly that is. Now, many people, like I said, use it for autoimmune disease, and some of the effects, which we'll talk about here, like the reduction in inflammation, can also benefit your weight. And so what I found out is as I was treating people with autoimmune disease, I was helping them, reduce inflammation in their body, and I realized, wait, they were also losing weight in the process. And so this is sort of how I stumbled upon it. Okay, so number one way, I think, actually probably in terms of importance, that it helps with weight loss is the fact that using Naltrexone can target insulin resistance, sometimes referred to as IR. Now, insulin resistance is often associated with high blood sugar, and it's the mechanism behind type 2 diabetes, okay? So this is present in about 50% of the population, so a huge percentage, all right? Insulin resistance is the reason that the keto diet is so well known and famous nowadays, and that's because lowering your carbohydrate drops down your insulin, which helps with weight loss. Now, what's interesting is that Naltrexone is doing that same thing, but it's working internally. It's not mediated through your diet, it's mediated through the medication itself. Now, there are lots of other medications which also do this, but Naltrexone does seem to have some properties which help it drop that insulin. So obviously, you drop insulin, you'll be able to burn fat cells, you'll lose weight. That's sort of how that works. So number two is it can cause an increase in certain individuals of growth hormone. Now, growth hormone is something that declines as we all age. Everybody, men and women, will see a decline in growth hormone as we age. And so it's often referred to sort of like as the anti-aging hormone. So the lower your growth hormone is, it's associated with a number of diseases. It's associated with an increase in obesity, a reduction in skeletal muscle, which is called sarcopenia. You don't have to know that, but the idea is that it drops your muscle masses and increases your fat mass. So if you can do anything, so if you're taking a medication which is going to increase your growth hormone, that's going to help you lose weight. This isn't a universal thing, though. It tends to be in certain specific people. It's not the main reason that it uses weight loss. We'll get to that in a minute and how I use it. But you should be aware that it can potentially increase growth hormone. And just to normal levels, by the way. This isn't like using growth hormone. This is just balancing out where it should be for the individual. Number three is that it modulates appetite. Now notice here I say modulate. I'm not saying it suppresses. There's a big difference here. Most people, when they think about weight loss, they think, well, I need to suppress my appetite, right? If I drop my calories, I'm going to lose weight. Well, not so, because we know that you have about a 1 in 200 chance of losing weight and keeping it off if you follow this suppression appetite sort of mentality, which is why we're not focusing on that. Instead, this helps to modulate your appetite. And what I mean by that is it helps your body to understand what it really needs. So many of you listening to this are probably a little confused. You probably don't realize this, but your physiology is confused, and you're having cravings for food that are not healthy. Okay, you might be craving, sugary foods or foods that are rich in carbohydrates, pastries, things like that. You're like, why would I want these? They obviously aren't healthy for my body. Now, taking Naltrexone can kind of reset the way that your brain sends the signals to your stomach and the way that they communicate with one another, which can help your body to kind of understand the foods that it should be eating. So it modulates your appetite. It reduces the food cravings that you have for unhealthy foods and can balance those out with healthy food. So that's why I think it's very important here. Now, I should touch on this too, which I didn't really talk about here. I think a lot of this is happening at the level of the hypothalamus. So I think naltrexone is probably modulating the way that your brain communicates with your fat cells through leptin, because there are people who use this and it kind of teaches and this is how I use it a lot, is it kind of retrains the body to drop your body set point, is what I call it. So oftentimes I think of your metabolism and the weight of your body sort of as like an air conditioning unit. So your brain says, hey, we're dialing up, like we're gonna dial the meter up to 200 pounds, okay? And no matter what happens, you're gonna be 200 pounds. You may lose 10 pounds, but your body goes, hey, wait, we like to be 200. So you'll lose 10 pounds and go right back up. Now, if you use naltrexone, it will help your body get down to that, let's say 190, and then it says, hey, by the way, brain, this is our new normal, okay? Back up here, it wasn't 200. That's not the healthy weight we're at. It's now 190. So it modulates your body set point, which is sort of like your, internal thermostat, if you will, for the weight that your body should be. So this is probably all happening at the level of the hypothalamus inside the brain. Again, that's probably maybe a little more than you want to know, but it is beneficial to have this understanding. The next one is it acts as an anti-inflammatory agent. Okay, then this is really important because I think a lot of people don't understand that when you become obese, your fat cells are sick. Okay, we have a name for that. It's called adiposopathy. Okay, so it basically means pathology of the fat cells. And this occurs because they're inflamed. So when they're inflamed, they don't work very well. So if you reduce inflammation in your body, it makes your fat cells healthy, which then makes them be able to communicate with your brain, to alter your metabolism, to increase your metabolism actually, and to help your body burn those extra calories that are stored in your fat cells. And this occurs because of its reduction and effect and it decreases inflammation. So that was kind of a mouthful. You don't really need to understand the physiology, but you do need to know that it acts as an anti-inflammatory, and this is also, by the way, why it's so effective for people who have autoimmune disease. Because what do they have? Well, they have immune dysfunction. And if your immune system is dysfunctional, then obviously there's going to be, your dial is sort of up in terms of its effects on your body, and it causes an increase in inflammation. So if you can dial that back down, you'll reduce that inflammation, and you'll again have that anti-inflammatory side effect. Okay, so the next one is that it improves sleep patterns. So it actually improves sleep as well. But oftentimes what you'll hear, if you've never heard about this before, is doctors will recommend that people take naltrexone in the evening or at night. And that's because it actually helps your body sleep. So I use it as a sleep aid, not really as a sleep aid, but I use it in people who are obese, but who also suffer from sleep problems. And you'll find a lot of people have obstructive sleep apnea as they gain weight, which reduces their sleep. And we know that if you drop your sleep, you will gain weight. So there's a really, really tenuous sort of relationship between sleep and weight, wherein if you gain weight, your sleep declines, and if your sleep declines, you gain weight. So it's sort of like a back and forth, a yin and yang, and in a vicious cycle. So you definitely want to make sure you're sleeping well if you're trying to lose weight, because you're just not going to be able to if you don't do that. Then the last one is that it improves directly thyroid function. Now remember, I said previously that it can be used to treat Hashimoto's thyroiditis, which is an autoimmune disease. We talked about that up here when we talked about the inflammation. I didn't mention Hashimoto's specifically, but that is an autoimmune disease, and it can be useful to treat autoimmune disease in general. But it also seems to have a direct impact on thyroid hormone levels. In fact, it tends to improve T3 levels and also T4 levels. So it causes a normalization or an increase in that. And we know from studies that the more overweight you are, the more likely you are to have thyroid dysfunction. So this is really important. If you can balance your thyroid, you will be able to dial up that metabolism and burn weight. Now, what's interesting is that, hopefully you guys are getting this, is that these are, 1, 2, 3, 4, 5, 6 different ways that naltrexone is really helping your body lose weight. And if you notice, it has nothing to do, except for, I guess it does modulate your appetite, but it's not suppressing your appetite. So the way that it's helping is a roundabout way, which is great because it can be used with diet, exercise, supplements, and so on. So I would encourage you guys to have an understanding to expand the way that you think about helping your body lose weight. And if you encompass all these things, you'll do really well. But I want to hear from you guys. Have you tried naltrexone before? If you've used it for autoimmune disease, let me know. Leave a comment below and just say, yeah, I've tried naltrexone. And tell me if it worked for you or not, because I've used it, oh gosh, I don't know, hundreds of times. And it's probably one of my favorite medications because it just has so few side effects, and it can help a plethora or a wide array of symptoms and conditions. So leave that comment below. And if you haven't already, guys, make sure that you subscribe and hit the notification bell if you like this sort of information, because I have a lot more coming. So that's all I have today, and otherwise I'll see you guys in the next one.